Okay, so I'm recording it. It will be posted for you guys as well. So remember our review sessions, the test will be the same as our last one. It'll be the same number of questions. We will have 5 math questions at the end. Well, the end for me, but throughout your exam. So make sure you have a calculator ready and things like that. Before we start, are there any questions? Friendly reminder, make sure this is downloaded. Your exams are downloaded at least 72 hours prior to your test time, because we do need to make sure if there are any problems that we can all solve them before the exam time. We have a lot of us tonight, and I'm glad about that. Like I said, this is a great way for us to prepare for the exam. So what I like to do in my review sessions is I like to pull up our study guide. So if you guys have that printed out, that'd be awesome for you to just have it in front of you. Because what I like to do is we're going to work together. We're going to come up with questions. We're going to come up with topics that we should know, need to know kind of stuff for the exam. So our study guides are really, really helpful. What I like to do when I'm doing it is I'll highlight on our Word document. I'm going to share my screen with you. I'll highlight with you what I think you guys should focus on. And if there are no questions, I don't usually do Kahoots and stuff like that and on my review sessions, because I find it easier for us to all work together. So given that, I'm going to share my screen with our study guide. Can everyone see that? Just say yay, nay.
Yes.
Good. Thank you. So a thumbs up. Thank you. Awesome. Great. Okay. Welcome, Sharon. All righty. We are going to look real quickly. I'm going to tell you for this exam, you need to know levels of prevention. Primary, secondary, and tertiary, both. Triple, sorry. So please make sure if at the end of this, you're still wondering, what should I know about that? You ask, because I will tell you. All right, so the first section we look at is culture and migrant workers. So we talked about in my class and in the other classes how migrant workers are susceptible to certain things. Well, who we're really looking at in this first paragraph is going to be our Mexican culture. So what we like to know about Mexicans is the Mexican culture, they prefer to be polite, non-confrontational, okay, when they're in relationships. Lots of times, and you know, I will tell you guys, specifically for the exam, we're focusing on our Mexican clients, but I will tell you across the board, a lot of times people will, who are English second language, they'll yes you. And what that really means is they don't know how to respond and they don't know what else to say. So on our Mexican culture, we're going to look at that sometimes they will just say, you ask them, do you understand? Yes, yes, I understand. But meanwhile, that may not be the case. Okay. So make sure when you're looking at that, we know that we are going to validate that they know what we're saying. Okay. So can somebody give me an example? You can just shout it out or say it. What is something we could do to validate our understanding with our Mexican culture?
Teach back.
We can use interpreter in case of they need one.
Use what?
Interpreter.
Yeah, an interpreter is good. What else could be?
You could ask for preferences in terms of culture.
Great.
That would.
I like somebody said teach back. That was on our last exam, so very good.
I was gonna say you can ask them to restate what you just said.
Mm-hmm. Now they may be able to, so what I would suggest as a nurse, maybe we would say, can you restate it in a different way? Because if they are able to just remember what you say, you want them to say it in their own words, right? So that they can interpret it. So remember with our Mexican.
Yeah, I think she's. You were froze, Miss Alani.
Oh, geez, Louise. Make sure you tell me. It says my connection's unstable, but I'm in my home, so it's not unstable. But thank you. So just remember, this is going to be true with our Mexican culture, that we're going to make sure they understand. So yeah, I get it. Just like any other client, we want that teach back. We want to validate their understanding. Okay, when we're looking at our physical demands, I want you to just think in your heads for a second, even if you didn't read this paragraph, which you guys probably have read already, but when you're doing physical labor, regardless of where you work, what are some things we're going to think of as a nurse?
Injury.
What kind of injuries are we going to think of when you're doing physical work?
Pain, like back pain.
Injuries.
Good. Back pain, I heard. Injuries. What else?
Environmental hazard.
Good. Very good. Environmental hazard. So the way to remember this, when we're looking at our migrant workers, if any of you have ever done gardening, you know what they feel like. Because I can tell you from gardening, if you spend a whole day pulling weeds, you're going to have back pain the next day, right? Any of us who have gardened, and I'm a terrible one, I kill all the plants, but just think of that when you're trying to remember what should I know about this. These people are going to be working heavy labor, really using their you know, having back pain, neck pain, chronic pain we're going to see. So how are we going to assess this?
You're going to ask subjective questions.
Like what? Give me an example.
Like what level is your pain from 1 to 10?
Beautiful. What else are we going to say?
You're going to ask them where they're.
Yep. Where's the pain?
What are you doing before the pain started?
Absolutely. Because sometimes, go ahead. Go ahead. What?
Does anything make the pain worse or better?
Good. Great. So the kind of pain assessment we're doing, remember, on our migrant workers is going to be the same kind of pain assessment we would do on a patient who's complaining of pain. But with these workers, they're doing a lot of musculoskeletal system usage. So really think about that, okay? I want you to focus on how we're going to assess that. Now, I don't need you to know specifically, oh, if they increase their, you know, pressure or things like that. What I want you to know is what is happening before the pain. And then that can kind of direct us as to where our assessment will go. Okay. And our health, high risk, greatest risk is going to be what?
Allergies. What is it?
Allergies could be one, but if they're working in the fall, you know, they're working every day in this. They're probably
environment.
Respiratory.
Yeah, respiratory. Yep, respiratory. Remember, it's going to be those things that are being sprayed around to make those crops beautiful and pretty and bright and grow a lot, right? So we're going to make sure, how would a nurse help with that? What are we going to do to minimize our pesticide exposure?
Use masks, gloves.
Yeah.
Yep.
Have them wash their hands.
Hand washing stations.
Yep. All of that. We're going to have them hand wash. We're going to make sure that we assess them. If they are complaining of any complaints that might be, you know, respiratory wise, we want to think about that. Remember now, guys, that when we're using these barrier devices like that we would use, they may not prevent our exposure, right? Because they're being exposed, whether they're protected or not. What we can do is minimize that, right? We can minimize our complications. Does that make sense?
Yes.
Okay. So if we said, as a nurse, let's come up with a question for pesticide exposure. As a nurse with a migrant worker, which of the following are important things to remember? A, hand washing. B, protective gear. C, reviewing the pesticides they use. That's a select all that apply. As a nurse,
all of them.
Almost. It was A and B. Because reviewing them is not really going to help us with reducing exposure, right? We could review them. Nice to know information, right? But I think we talked in my class about how when you start a job, that like orientation time, if you're working with like chemical weapons or you're working with any of those environmental hazards, we're going to teach that before they're exposed, right? All right, so any questions on pesticide? Just know it's our greatest exposure, our greatest health risk. And these are some things we can do as a nurse, because we always want to think when we're looking at the questions, what can we do as a nurse? All right, we move into, it's kind of a jump, but we move into alcohol, tobacco, and other drugs, poverty, and HIV. Remember, we should know this from Med-Surg. How's HIV transmitted?
Sexually.
Needle exchange.
Needle exchange. Yep. How else?
Body fluid. Mom to baby.
Yeah, from mom to baby.
Mom to baby, yeah.
Mm-hmm. Think about what's in our community that's trying to prevent needle exchange. What do you guys know? Any of the programs that they have out there?
Providing needles for people who use them.
Great. And I want you to think about that. Sometimes people say, oh, well, why are you giving them needles? Well, the truth of the matter is, and we all know this, if they want a needle, they're going to use what they have. So giving them clean needles is a way, okay? Those people that are going to be high risk, another good to know is going to be those ones that are going to be using IV drugs. Recurrent sexual infections, multiple sex partners. Right? This should be kind of a review for you guys, this little section, because I'm sure you've learned about this in Med-Surg classes. Homeless adolescents living on the streets have a greater risk of risk-taking behaviors. I want you to use common sense on something like that. Think about the homeless population and these adolescents. They haven't really had the education that some other adolescents have had, right? So we're going to see a higher risk behavior, poorer health status, higher risk for things like AIDS and hepatitis B, right? Why are homeless teens? Why do you see teens homeless?
For tons of reasons.
Like they run away from home.
Yep, you're going to see runaways. What else? What's going to cause a teen? I want you guys to just use your brains on this one. What's going to make a teen run away from home?
They want their freedom.
Physical abuse.
Abuse.
Yeah.
Abuse. They want their freedom. Remember, we're looking at that age group and that developmental phase, right? They think they know what's going on in the world until they get out in the world. Okay. So we're going to see those kind of abuses. We talked about that teens are at higher risk of violence in relationships as well. So I want you to know that. All right, our next, I think that's about all I need you to know on that one. And we look at our next paragraph. Poverty directly affects health and well-being, okay? We know, and this is important, an important list to know, that we see higher rates of chronic illness. We see higher rates of infant morbidity and mortality. We see a shorter life expectancy, more complex health problems, more significant complications, and hospitalization rates greater. Why do we see this with our poverty group?
They don't like going to doctors because they cannot afford it.
Okay, they can't afford doctors. Good. What else?
Accessibility to healthcare.
Excellent. Accessibility. Tell me just a little bit more about that.
Depending on the area of the community, sometimes, especially like in rural communities, it's far and few between.
Yeah, they don't have, hospitals are so far apart, and they may not have one close by. Think about also the priorities. If you're really in poverty, do you think going to get your well-check visit is going to be a priority, or do you think putting food on the table is going to be a priority?
Food before health.
Absolutely. And anyone who's dealt with poverty themselves or as a nurse, that the people really need their basic things met, right? And we know that about all of our patients. Any questions on what poverty is going to affect? Think about, now I don't want you guys memorizing. I want you to, when you see these things, I want you to think, Well, they don't get the access. They don't get, you know, they're going to have a shorter life because they're not going to the doctor. They're going to have more complications because they're not checking stuff out. They probably are not able to afford the medications if they haven't applied for assistance care, which, you know, keep in mind, poverty is a huge thing. And so we may see these people not getting healthcare because they don't want it. They're not getting healthcare because they can't access it. Secondary. All right, so we talked about this a little bit. Why? They can't pay for healthcare, lack of insurance, location, language, inability to find one. They can't get there. The hours are not good for them. And they also feel, there is a feeling that healthcare providers don't treat poor clients well. And, you know, that's their impression. And so are they going to want to run out to the doctor? Absolutely not, because they're going to say, well, he's going to place judgment on me, or they're going to say, why haven't you come to the doctor? And I don't know about you guys, but I can say personally, I've been over COVID. I was a little concerned about going to the doctors for lots of reasons. And when I finally went, they just said, we're so glad you're back, you know? So think about, for the poverty clients, there could be a lot of judgment, just like I was afraid to go back, to be honest with you, because I was like, they're going to say, what have you been doing? And that was the dentist. So, but you know, I was too worried about that. So think, when you're thinking about this and studying this, think about the poorer communities, and they feel like there's going to be a judgment placed. Okay. We move on to alcohol. And what do you know about alcohol? Just give me some facts you know about alcohol. You don't even have to study the study guide for this.
It's literally a risk factor for every disease process.
Okay, it's a risk factor for sure. What else? What happens when you have too much wine or too much beer or too much whatever your drink of choice is?
It impairs your judgment.
Absolutely impairs judgment. What else does it do?
Depress your central nervous system.
Yeah, central nervous system. It does depress the central nervous system.
You don't eat, prevents you from eating.
Mm-hmm. Yeah, you may not be hungry, right? Because you're filling yourself up with empty calories, right? No, also, and for anyone who's had alcohol in their life, oftentimes it'll have like a sedative kind of effect. It'll make you calm or tired, or, you know. And so when you're doing something like this, we are gonna not take something that is going to be an hypnotic agent. The example that's given in our study guide is phenobarbital. Why are we not going to give this if you're having alcohol, or alcohol is our drug of choice? What's that going to happen? So you have a glass of wine and you take the phenobarbital. What's going to happen?
You're going to be sedated.
Sedated.
Yes, it'll, yeah.
Hypnotic effect.
So does it depress the respiratory system?
Sure, it could. It's central nervous system, so it could depress almost anything, right? So we're going to really teach our clients who are, you know, drinking alcohol, that we want to be careful with any cross-contamination with any medications like phenobarbital. That's one I would kind of keep in your head, because that's a good example. And that was just one little blip. I'm going to actually put a space in between these two paragraphs, because I feel like that's just something to think about when we're looking at our alcohol and tobacco and other drug use. We go back here to our high risk population. What is another word for this high risk group that we talk about?
Vulnerable.
Thank you. Good, good, good. So our vulnerable populations, we're going to take a look at them. What we need to make sure we have, like we do need with any nursing, we're going to need physical and psychosocial assessment skills, right? They have to help with promoting health. Look at the whole picture. We talked about this a lot. Remember, now this goes back to also something else that my class talked about last night, and our agent, our host, and an environment, how all of those things play a part. Remember the person, the family, the community. And we've talked about going into the home. What does that tell us? How much information can we get from a home? a ton. Because we can walk into the house and if we see their oven's not working, their refrigerator's not working, they're all by themselves, they, you know, there's animals running around, they, you know, it tells us a lot about the person. And oftentimes families are together in a home, so we'll see information that way. When we're looking at health promotion, we want to look at what could we work on. College kids, we're going to say we've seen an increase in smoking. So, and with vapes particularly. So we're going to look at smoking cessation for college students. And then for our adults out of college, and most of us are adults that are here out of college, the traditional college, 18 to 22 age. So think about what are we always told when we go to the doctor? Exercise, don't stress too much, right? And environmental hazards, which we have a whole chapter on. Any questions on that one? What I want you guys to do when you're looking at the study guide is like put it into, and I've always done this with nursing, in my nursing career, I try to make it make sense to me in some example. A lot of times I do like phonetic stuff. If I have to remember P, this, that, whatever, I'll say like, oh, P stands for. But like on these are like, you know, think about it. What are adults being taught? You've taught, almost all of us have had adult clients. What do we talk to them about? If they're relatively healthy, we're going to say you got to exercise, even if they're not healthy, right? Even if we have cardiac patients, we're still telling them you got to get out there, you got to move. Stress reduction, we know that's a big one. And we want to look for those environmental hazards in the home, like lead for kids, right? But go ahead.
Okay, so is there such a thing as old environmental hazards versus new age environmental hazards? Is that like a thing in the book or with the subject matter?
No, and it's funny you bring that up because like lead, you know, has been stopped since 1978, right, in homes. So you would think that's like an old environmental hazard, but it's active now, like it's in homes now. And so I wouldn't say there's any old or new. Yeah, sure, there's new things that we found, right? Some of the exposures that we talked about in my class with this chapter, we did like water safety. That's been around like forever since we've had water, you know. Our filtration system's better. I use this as an example in my class. Think about water safety. Has anyone, and I've gotten it several times, and I live in not a desolate community. Well, the water line, sometimes with the water line, boil your water before you use it. So those things that you're thinking are like old and new. The unfortunate part is the old are still the new because things have gotten worse, right? Think about our climate. You know, global warming is newish, but I mean, as time goes on, it's getting worse and worse and worse and worse and worse. So those old things become new. So that's how I want you to think about it.
Okay, so that won't, I'm just asking that in terms of the test. So it's not like they'll specifically be asking us for new age.
No,
environmental hazards. Okay.
No.
Thank you.
I don't even think that, I mean, this is my personal opinion. I'm not, I mean, I've read the book several times, but I don't like to say that because environmental hazards are there. I mean, whether they came up within the past 10 years or they've been here for 30, I mean, does that matter? No, we're still assessing for them, right?
Okay.
We're not going to focus on that, something silly like, well, that's my opinion, silly, but anyway, we have this little paragraph again, and I don't know why we skipped around a little bit, but this is again about alcoholism. What I want you to know about this one is you're going to see a decrease in vitamin B12 and folic acids. We talked about their malnourishment, where they're not going to eat, they're not hungry, that kind of thing, because they're filling up with those empty calories. So, you know, a lot of times they'll say, I'm not hungry, because they're full. I mean, they've just consumed, you know, a lot of calories, but in a liquid form. Okay, so know that. Nicotine and caffeine, we don't worry about deficiencies like that. We really just worry about that with alcohol. Okay, marijuana, I don't know if anyone has known a side effect that we see with marijuana a lot of times that clients have shared with me is that they're very hungry after consumption of it. So that would be the total opposite, right, as of alcoholism. But that's not always the case, and depending on the dosing and whatever. But so just know for our alcohol use, we're going to see that B12 deficiency and folic acid down. One of the drugs we talk about is caffeine abuse. Now, I was in nursing school. You guys are all in nursing school. I'm sure we all have consumed plenty of caffeine in our time so we can stay awake and study, right? Not a good thing to abuse it though. And so I want to be very careful with that word, caffeine abuse. So we see with those kind of things like Red Bull, those energy drinks, what happens? Makes the heart rate.
Heart rate.
Yep. You're gonna see heart rate. And so watch for that. You're gonna have palpitations, okay? That's a definite on caffeine. And I have to say it's been very sad, but over the past couple of years, I can't even have a cup of coffee or I get palpitations.
But caffeine is a vasodilator, so I wonder.
So does anybody know why it makes the heart race? What does it have in it?
Yeah, that's always my question.
Stimulant.
What?
It has some stimulant in it.
It's a stimulant. It is a stimulant. So any stimulant is going to make, everything race a little higher, faster, quicker, right? So while it may let the blood flow a little easier, dilate, make the vessels a little bigger, that's still, you're just going to have something in there that doesn't really matter what it does to the vessels, right? The vessel, it's not that the vessels are the problem here. It's going to be our stimulant and they're causing palpitations. On our vaping oil, we talked about this. Who are we worried about with the vaping oil?
Children.
And the smokers themselves.
Oh, yeah. But hopefully the smokers themselves aren't drinking the liquid too. I mean, I guess they could, right? But I can't imagine it tastes good, but I can't speak to that. But anyway, our vaping oil is going to be huge with kids because they may look at it and think, oh, look at this liquid. And it is actually poisonous to young children. So good, very important to know about vapes. So if you see a trend here, we did caffeine, we did alcohol, we're doing vaping oil. These are all our, this was out of one full chapter. And so we're covering all of them on this. So if we have a young kid at home, what are we going to talk to the parents about?
Putting it up.
Safe. Avoiding vaping or just safe storage.
Yeah, and safe storage. If they say, well, I just put it on top of the fridge, isn't that safe? What could we say to them?
The kids can climb.
Good. Yeah. And we're going to say it in a therapeutic manner. Of course, we're not going to be like, well, dummy. I mean, of course they can climb, right? But we're going to say like, well, my concern with that is, kids get up there. So put it away so that they can't and let them know that it's poisonous. I would bet a lot of people don't know that. Right? I'm going to skip this for a second and we're going to go to risk factors for alcohol and drug abuse. We're going to see, and this should be something that in our brains, we like kind of know, but if we think about it, why are people just based on our experiences, why are they going to look for an scapegoat or something that they want to use so that their brain is altered? Maybe some childhood trauma, maybe violence, same kind of risk. What?
Some people do it for stress.
Yeah, to relieve some stress. Yeah. And, and so no judgment there. I mean, however you manage stress, is how you manage it. What we do as nurses is we help them cope with whatever their stress technique is, right? So think about it. A parent with addiction, you will see a direct genetic correlation with that. History of any mood disorders, and if they don't have coping mechanisms. So what's a question if somebody had to come up with one from this paragraph? Come up with a question for me for the test.
What are the risk factors related to alcohol, tobacco, and other drugs?
Okay, and what would be my choices?
History of childhood trauma, being victim of violence, having a parent with addiction, history of mood disorder, and lack of adaptive coping mechanism.
No, I can't tell you because I haven't looked at the test myself. I mean, we all help write it, but
I'm reading the paragraph, right?
Yes, you sure are. And you're doing a great job, because I would imagine that there may be like more than one answer for risk factors. So what are those questions that we always see that have more than one answer?
Like all that apply.
You got it. Select all that apply, right? I promise you, I don't know the question for this, but if I had to guess, I'd say probably select all that apply, because there's lots of risk factors. And all these things I want you to think about. Why is someone going to do this? It totally makes sense. I mean, you know. All right. So I go back to this paragraph here because there are 3 or 4 different paragraphs in our study guide that have to do with primary, secondary, and tertiary prevention. So I'm going to skip them, and at the end, we'll go through them together. Okay. Because that's, I'm telling you, that's on your test, and that's going to be a big part of it. So we'll come back to that paragraph. I promise. Remind me at the end if I forget, but I won't. I hope not. I could, but let's hope I don't. Okay, so when we're looking at mental health and illness, we are always talking about effective therapeutic communication, are we not? Always, always. This will be on your NCLEX, I will tell you that. It's huge in nursing exams. So what are some ways we can use therapeutic communication? Somebody give me a question that they think would be therapeutic. All right, I'll give you a scenario. I'm your patient. I'm feeling really sad today.
You say you're feeling sad today?
Can you tell me more about it?
Okay, good. We want to avoid saying, why are you sad today, right? Because we want to just acknowledge it's being said and don't, you know, because why tends to not be therapeutic, because then there can be like that feeling like, well, why are they asking me why, right? So you're feeling stressed today, you said. Can you tell me more is always a good one. Can you tell me more? Okay. And that leaves it open. There's no judgment there.
Could I ask them what I could do to help them feel better?
So I wouldn't say that's fine to do, but I wouldn't say that would be a therapeutic communication technique, because you want to really keep assessing, right? And so you are not going to be able to necessarily do something unless you know your needs assessment, like what do they need, right?
Yeah.
So like and I like that you brought that up, because I feel like a lot of people would want to ask that, what can I do? Because as nurses, we always want to help them fix it, right? But what can we do? Interventions, we can try, you know, but we need to really hear what's going on before we can say, hey, you know, what can I do? We all know that stress contributes to adults' mental health status. And I think you guys are examples of that, because nursing school, man, that is a stress. I remember it, and I would never go back. I love my job. I love my career, but I would never go back to nursing school. It is too stressful. So what are some sources of stress? Think about yourselves. What makes you stressed? Why are you stressed as a nursing student? What is put on you that, what's put on you that makes you stressed out?
Having to critically think about things that I didn't have to before.
Okay. So you're thinking about lots of things. So you got a lot on your mind. What else?
Study versus study and job at the same time?
Absolutely. You're studying, you have a job, you're studying, you have a family, you're studying, you have a baby, you're studying, you have 3 dogs. I mean, think of all the multiple responsibilities we take on in nursing school and as nurses, because nursing is not an easy profession. So we have to be on for our patients, and then we come home, and sometimes we need that downtime to decompress, right? But if our child needs us, and I can tell you many times, I leave work and I rush down the highway and I make sure I'm at school on time to make sure that I get there so that, you know, my child's not standing outside waiting, you know, I mean, it's multiple responsibilities. So that puts stress on us as nurses. So think about, you know, our multiple roles, job insecurity I mean, that is something that's always on the table. Lack of resources, unstable relationships. You know, if you're in a relationship that is maybe abusive or something like that, I mean, think about how is that going to cause stress in your life? So These and other conditions. Okay, so we know what that's going to be something about stress. I know on the test, but we all know we're all stressed. I bet every single one of us could tell you a list of things we're stressed about. Probably all of you are stressed about the exam. So, but don't be. We will get through it. Objectives, healthy people 2020. We love these. We love these. So objectives are aimed at helping people access treatment to decrease rates of suicide with human and economic costs. So that's one of those need to know kind of things. It's an objective, and I would like you guys to know that. Okay, and then at some time or another, and I just said this to you guys, but you know, it's true. At some time or another, you know, as adults, and unfortunately children often will experience some sort of serious setback, grief, distress. No, our depression is going to change our way that we function, right? Everyone knows, if you know people or have been around clients that are depressed, you know, it changes their lifestyle. Know that what ends up happening with mental health, which is really, really important, why we need to be good assessment teams, that a lot of times these depression and mental health, we're not going to be going to the doctor for, but when we're there, how are you feeling? Have you had any thoughts? Those kind of things are questions that you usually will get, so that we can screen for those mental health conditions, right? So we should know it's important for nurses, regardless of where you work or who you work with, you are going to make sure we're assessing for mental health. Okay. We move on a little bit to teens and health. We talked about violence with teens. That's our #1 risk factor with our teenage population, with relationships particularly. And why is that? Anybody remember why? No.
Homicide.
Yeah, but why is violence going to be not popular? Geez, what word am I using? Why is it going to be more common among teens in relationships?
Oh, in relationships.
That's a big risk factor for teens.
They're trying to find their identity. I'm not sure. I don't know.
Yeah, but maybe they don't know what a relationship is, right? So they may not know, is this normal? Is this not normal? You know, teenagers, they don't really know. They're trying new things. And so we see violence, particularly during pregnancies. And we know what happens with violence in pregnancies. What's going to happen? The mom's going to get hurt. The baby's going to get hurt, right? So we have an increased risk there. For partner violence, just kind of know that teens are more likely to be in the violence category. We're going to do frequent routine assessments when they're pregnant, particularly. Because think of the stress of a 16-year-old, pregnant 16-year-old, and the boy that's gotten her pregnant, and how much stress that puts on them as, you know, kids, and they have their own stress. They have multiple things they have to worry about. So we're going to see frequent routine assessments. We're always going to look and see for those bruises or those marks. And if you see them, what's a therapeutic way to say what's going on with the bruises? Which we wouldn't say that.
Tell me, how did you get those bruises?
Tell me more about, I see these bruises. Can you tell me more about them, right? Good. Make sure you're supportive. We know that we need to do this. Okay. Here's where we're going to do our primary, secondary, and tertiary. There's going to be like several different examples. I told you there's several different paragraphs. Focus on primary prevention is preventing it before it happens. Okay. So I like to remember P and P, primary preventing. Okay, so on primary, we're going to have several examples, and we'll go back to our drugs and alcohol, because that was where we first saw it. But remember P and P, preventing and primary. And so up here in our paragraph, Drug education is primary prevention. Remember, anytime you see the word education, well, I won't say anytime. I take that back. Most times when you see the word education, I don't want you to remember E. Okay? Because primary. Whenever time you see education, so you think P and E. So I have, the way I remember primary for things that I'm going to see is E. So I'm always thinking education. Who can I educate? So we're going to do drug education at the elementary schools. Down here, when we look at our primary prevention again, we're going to do maintaining a normal BMI, right? Because we don't have any problems. We're trying to prevent problems here. Okay. And then we look down here and they talk about primary for seniors. We're going to have walking groups for healthy seniors. So if I were you and I were studying, a way that we might be able to make notes for ourselves is make a list. Primary. So we're going to see primary walking group. We're going to see maintaining a BMI. We're going to see, what do we say up here? Oh, drug education for young kids. Okay. And then on this one, and then we take a look at secondary. So with our secondary, we're going to be doing something so that we can help to minimize, okay, and early identify before we have complications from something. Okay, so education on the purpose and frequency of pap smears is going to be, think about why pap smears are not primary.
You say screening.
Yeah, but if it were a screening, it would be primary.
I think it's primary, secondary, and tertiary. So in that scenario, then secondary is screening. That's probably why he said that, because that's the three arms that I know.
Okay. Okay. So it really depends, and I hesitate on using the word screening. I know the book uses it a lot, and if your teachers have told you screening, think of that for secondary, then you stay with that and do that. I worry about that because based on what is being screened. But for our studying purposes, primary blood pressure screening, it's going to be secondary.
Okay.
And then I know I don't like the word screening, just so you know. I don't like that because it makes, there's lots of different ways you can see that. But for our test, we're going to know blood pressure screening. Okay. Educating on purpose and frequency of pap smears. While our education is usually primary, does anybody know why this is secondary?
What? You mean the pap smear?
Yeah.
Pap smear is a prevention.
Screening is a test.
So screen test.
I didn't hear that last part. What?
Screen test.
Test.
It's screen for the pap smear.
Yeah, but
secondary.
Yeah, well, so now this is where I need you guys to understand primary and secondary, because there's like some fine lines there. When you're doing something like a pap smear, you're not going to be just putting it out there, right? We're not going to just be providing information, right? Because you're not getting a pap smear if you're a boy, correct? Correct. Just like girls don't get prostate exams. So you can't really say to the general, well, this is like we're preventing something, because we're very specific to the group here. So there'll be another example. There was another example that was going to an providing free STD testing. Okay, you're not going to have that as primary. You're going to have that as secondary, because in order to have that testing, what do you need to have happening already? You're not going to provide it for people who aren't having intercourse, correct? So that's why these are going to be secondary, because you have like a condition that's on there already. Does that make sense, or have I confused you completely?
Yeah, I don't think you're the one confusing us. It's just all muddled in with the concept of primary, secondary, tertiary, and the way I know it, primary is preventative, secondary is screening and test, and tertiary is treatment. So now that it's broken down to just primary and secondary, and tertiary is not even a thing, then it's kind of like we're putting things into different sections.
Different categories. Okay, then I want you to, okay. And can you tell me, where did you learn that? Primary prevention, secondary screening, and tertiary treatment?
I believe it's community. Someone else can help, I mean, verify, but
Did we hear that from a professor, or we heard it from the book?
And the book.
And the book, yeah.
Okay. Okay, so then that's how I want you guys to remember it. I teach it differently, but I want you to remember it the way your professor taught it to you. So when we're looking at this screening, I mean, so we'll go based on that. That's not how I teach it to my class, but that's fine. So what we're going to say is primary is going to be prevention. So early identification, preventing. We're preventing for walking group for health seniors. We're preventing. What are we preventing then for walking group for health seniors?
What do we, osteoporosis, for example?
Okay, cardiac.
Cardiac, exactly.
Circulation.
Diabetes.
Yeah, we're keeping our weight down for them, good. So then on my secondary, then right here we have blood pressure screening. We have a screening on a pap smear. So I'm gonna teach it to you guys that way for review of the exam. And then back up here, where is that paragraph? We're gonna have the use of a risk survey for our secondary. All right, and then we're gonna use T for tertiary treatment, right? And that's gonna be, we're treating addicts here, so we're doing rehab. Oops. And then down here, we're gonna have treating support groups and counseling with existing problems. So we're treating them with support groups and rehab, right? And on this one, we're using prayer or low sodium diet for something that's already happened. So we're treating it with low salt diet. Okay, so we're gonna go with what you guys are saying to me, how it was taught to you, because I do like that.
Can you even see it? It says it right there. Using prayer or low sodium, blah, 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 is tertiary prevention. You see it?
Right, yeah, it's treatment. It's a type of treatment. All of these paragraphs have primary, secondary, and tertiary. You're gonna have to know all three of them for the test.
Okay.
So we were just doing primary and secondary initially, and then we were gonna hit tertiary.
Okay.
But, so we did hit it here.
Okay.
Let's see. This one is about hemoglobin A1C, so that's kind of random out of there, but so most effective way if we were teaching to our diabetic clients is going to be evaluating hemoglobin A1C, right? Because we're going to look at this. A post-test and return demonstration is just going to say they understood it, not that they didn't implement it. If we look at a survey, it's not going to, it's going to be what they think of it. We're not going to see how effective was this. Okay. So for quality improvement, we're going to look at quality improvement is a big thing in healthcare right now. How are we trying to fix things, make everything better? We're going to monitor care. We're going to see and look at opportunities for improving it, collect data, make recommendations, evaluate care and services. So this is one of those lists that I like you guys to know. When you're remembering this about quality improvement, think about how am I going to improve what's going on? In order to improve it, I got to watch it. I have to see what can I do to make it better. I'm going to come up with guidelines to help, and in monitoring care, I'm collecting data, I'm seeing how it works, and then I'm going to reevaluate. Okay. The results of these clinical data. I have to look at mine. Let's see the results of the data. There's a ton of information on our study guide, so I want you to focus use. Okay, epidemiology. What I want you to know about this is going to be, I'm skipping that paragraph, I'll come back to it. Epidemiology, I want you to know the triangle. Remember that agent, host, and environment. And in my class, I gave a page number that referenced examples, and I liked for you guys to refer to that. Let me see, I had the page number down for that. Page
139.
Yeah, 139. It was a box. Good.
Box 9-1.
Yep, there you go. That's exactly what I'm talking about. And remember, they all work together. So a change in one will change our outcome. All right, environmental health risks. My class talked about this last night for a long time, and we need to know how to assess them. Now, this is nursing process here. We're going to assess, try to reduce or eliminate, see what we can do to that, educate, advocate, and support a healthier environment. 10 principles that you want to know as a nurse. Let's break these down so they're a little easier. Nurses need to know about environmental health, right? Of course, if we're going to talk about it or help it get better, we have to do that. They should not use products that harm the health or environment. They should have the right to work in a safe and healthy place. They should be multidisciplinary. Now, this is any type of nursing, so all these would apply, right? But this is specific to environmental. The choices of materials, products, technology, and practices are best practice. Nurses should respect the diversity of the people who they come in contact with. Nurses should have the right to know timely information about the products. And nurses should participate in research and advocacy. So this, guys, I want to emphasize here should be kind of nursing practice. Because all these things, although we talk about it with environmental health risks, this is nurses we should be thinking about as we're looking at our environment. Is it safe? Do we work with other people? Do we look at the products we use? Do we respect the people? You know, do we need to know when we're around something? Think about those nurses in the chemotherapy units. They have special protection and bags are labeled and they're covered just so that, you know, we're having a safe environment for them. Any questions on that there? I want you, when you're reading this study guide, I want you to think about it. And like I said, apply it to what you know. And so practice is a good one. Faith in hospice nursing. Let's see. We're going to, with hospice nursing, you're going to be dealing with questions on the exam about how to cope with the death and dying. We want to make sure that we know they need support and encourage them to be present. But I don't know how many of you have had this personal experience, but for some, they can't be. So what do we do as nurses? We support them, okay? We listen and encourage them to talk about what they're going through. We talk about Medicaid and Medicare here. Those are our two federally funded programs, right? The way I taught my class to remember this is Medicare, you're caring for people. The Medicaid, those people need aid. So the word's right in there. So Medicaid, income-based, okay. Any questions on Medicaid and Medicare? Medicaid is going to go to those people that need aid. So they're restricted from their income for disabilities, things like that. There's an overlap with Medicare and Medicaid. No, you can be covered by both. Okay. Our disabled homebound status people are going to be in our Medicare population. Okay.
I just wanted to clarify, you said you're going to go back to the quality improvement section?
Yeah, I will.
Okay, I just wanted to.
Yep, that one paragraph, I'll go back to that. There's a ton in that. So I want you to know Medicare and Medicaid and who it would cover. Okay. So now Medicare is going to be our homebound, is going to be our 65 and older disabled homebound. And then our Medicaid is going to be not necessarily the same, but we're going to be looking at income based there. When we go into a home, and I've talked about this several times with my class, and you guys probably have too, what are we looking for in homes? Things that might be a potential risk. What's going to be a potential risk?
Throw rugs.
All risk.
Yeah.
Spread of disease. The risk.
Not good lighting.
Yeah, those are all identifiable.
I said spoiled food inside the refrigerator.
Spoiled food in the fridge. I want you to know that one for sure. Non-skid mats. They're going to prevent falls, carbon monoxide, prevent carbon poisoning, prescribed meds should be in original bottles. So any of those things, I want you to know about.
How about extension cords?
Yeah, extension cords if they're laying on the floor for sure. Right? Because that's a tripping hazard. These two definitions I want you to know. Spirituality is going to refer to the attitudes and beliefs. And our religiosity refers to the behaviors, beliefs, and practices of a religion. So the way to remember that is spirituality is really, what do we think? Not us as nurses necessarily, but what our clients think about a non-maternal force of life. We're not going to use the word, there's so many different words for a higher being, but a non-material force of life. And religiosity refers to religions. This was one of your attestation questions. 2 different types of community nursing. Faith nursing that we have. Congregation based, where we're going to be working really on that congregation exclusively, and then our institutional, we're going to be looking at how can we work with other people. So the way I want you to think about is, remember this, is institutions, and it's right in the word, institutional based. Institutions, they don't work alone. There's not one person running an institution, right? Regardless what the institution is, a college, a healthcare institution, there's never one person running it. So that's how I like you to remember institutional. You think about the word and say, well, if it's institutional, it's not just a nurse all in the room. Whereas you're going to have congregation, that has the word right in there. It's going to be focusing on just those activities of that congregation. Okay. Now this kind of goes under home health as well, which kind of overlaps with our parish nursing and our hospice nursing. When visiting a client who's a new mother, we want to make sure that we see infant bonding. That's really important. But our priority as the parish nurse is going to be that bonding time. Breastfeeding, good to know, nice, but we're going to really look at that and see how are they bonding, because things like breastfeeding techniques, that may not be for us. I mean, they have special nurses that take care of that as well, but we can help with environmental hazards and sleep schedules, but that's not going to be our priority. Our priority is going to be the bonding with mom and baby. Okay, people who want to pour. Okay. We talked about this quite a bit, that there's a stigma that people in poverty and poor, they feel is on there. Make sure, and you be cognizant of your own biases. Make sure that when you're speaking with them, you tell them, hey, there's this resource, there's that resource that can help and, help you out. So when you're looking at those kind of things you can do with the poorer communities, rural communities, decrease in health status. We know why. We talked about this. They don't have as much access. And we see chronic disease more prevalent among our rural clients. Okay. No, in rural communities, this is sort of out of order if you ask me, but we're going back to the rural, so it's okay. So if we talk about rural communities, we know there's a lack of cohesion sometimes among that rural community. And so you're going to see these clients less likely to share health issues like sexual assault, drug use, or depression. And our nurses, when we're looking at our older clients, transportation is going to be our #1 barrier for older adults living in these rural communities. Okay. And we are going to about finish up. We're going to look at environmental health and epidemiology. I'm going to skip to this one right here. When calculating this cause specific mortality rate, the nurse will take the number of deaths divided by the total number of population. So no there, that's how you would calculate. That's a definitional question there. The number defines the estimated risk for death from a cause. Epidemiology work with the reporting of a health event. No, the risk measures the probability, the proportion determines the number required to measure, and the rate is the frequency of a health event that occurs. Okay, so those are kind of vocabulary-ish things to know, but I do want you to know all of those. Our cause-specific mortality rate, no, is going to determines our risk for death. Here we go back to our epidemiological triangle. We know it's the host, the agent, and the environment.
As what did you just highlight for epidemiology, that section? Yeah,
the whole thing. The whole thing.
Oh, okay, thank you.
Because it gives you examples right there. So our host is the living thing. Agent is a factor that must be present, such as bacteria. And so our host, we're going to look at our immunological status. And for our environment, we're going to look at our things such as plant, water, and reservoir.
Thank you.
When designing an epidemiological study for the first time, the ecological design is the best use. It's quick and easy. And where our case control and our case studies are going to be a little harder because you got to interpret them. We go to environmental health risks, and we're going to know we're assessing for sources of those big things that we talked about: poisoning, mercury, lead, right? So we're looking at those big ones: poisonings, mercury, and lead. Healthy People 2020 related to environmental objectives is what would benefit our migrant workers to reduce our pesticide exposure. So we see our pesticides popping its head in Healthy People 2020 again. Okay. We are almost done. This is a ton of content, guys. I know it is, and I'm trying to focus you as best I can. When assessing environmental risk, we're going to look at things like, this is a repeat of the paragraph before. We're going to look at things like lead, like poisoning, like injuries, and a gate around a pool, an alarm on a door, security cameras. Is this something we're going to worry about?
Yeah.
Those are all good things. Having a gate around a pool keeps the kids out of the pool, keeps strangers out of your pool. An alarm on a door, that's a great safety feature to have. So if somebody's coming in, right? So these are reducing environmental risks. We look at those occupations that have a higher risk for respiratory conditions. We're going to have our coal miners, our construction workers, and our glass makers. If you work in an office building, on a farm with animals, this is where someone came up with the allergies. I wouldn't worry too much about that. But what I would tell you is our highest risk factors are going to be those guys that are and women who are being exposed to those coal and the glass makers and construction workers. Okay. Occupational health, we talked about last night. We see an increase in burnout and exhaustion. When assessing for physical hazards in the workplace, remember the word physical. We want to look at temperature and noise levels. Transmission of TB, we talked about this last night in my class. Transmission of TB, we're going to see a huge problem in close quarters, such as jails and our hospitals. And for our levels of prevention related to an occupational nurse. We're going to look at providing safe. We're going to look at things that will prevent, right? That's what, what's the word you guys know? Prevent. And then is primary, secondary is screening, and tertiary is treatment. So we're going to look at tertiary level here. We're going to be treating something that has already happened. Okay. Oops, I underlined that instead of bold. And I do want you guys to know the what our NIOSH and our OSHA is for. OSHA is going to be occupational standards, and National Institute of Occupational Science Health is to conduct research, identify occupational health and safety hazards, and distribute the research. All right, so I've highlighted for you guys a lot on here. I've bolded a lot for you. Made lists here that I want you to know. I've about covered everything on the study guide. I know that was a ton of information. And sometimes it's a little drier than others. So we didn't have a lot of times to necessarily have developed questions. But at this point, what I'd like you to do is I'd like us to develop some questions. What's something that you think we're going to see about epidemiology on this? Do you guys want to come up with questions, or you don't want to? Because nobody's answering.
Yes.
Name the three elements. You would name, what are the three elements of the epidemic or
epidemiological? Okay. I also want you to think about, we're not going to ask you what are they, because remember we're trying to apply our topics here. So what?
Examples?
Yep. What's an example? Women, and say what's an example. But blank is an example of.
Like an agent. An agent would be like whatever is carrying the disease process. Humans might be a host, and the environment is like a dormitory or something.
Yeah. Just know your examples and things like that. Let's think about, what are we going to see in hospice nursing? What are we going to focus on there?
Care and right, helping them live the best quality of life.
Right. What are we going to do with our families?
Therapeutic communication with the family members.
Yep.
Support. Go ahead. At the home, when we're looking at the home, what is something that's a big one that we should worry about?
All risk. Mats, refrigerator.
I'd worry more about a refrigerator than a non-skid mat if I were you.
Oh, okay.
Expired milk.
Yep, expired milk, contaminated food, good. What's the difference between spirituality and religiosity?
Religion versus beliefs.
Religion versus our beliefs of what's going on. Institutional model, I gave you a way to remember that. Anybody remember?
Yeah, institutional is more than one, yeah. And congregation is like centered to the community.
Yeah. Okay. I'm sorry, just 1 second.
Okay.
What else? Let's see. What else? Definitional for epidemiology, we're going to be looking at risk, proportion, rate, risk factors. Now, our cause-specific mortality is going to be number of deaths divided by our total population. And what does that do? It gives us an estimated risk. Okay. Some environmental hazards that I might be worried about.
exposure.
What? Lead, what else?
Pesticide for the migrants.
Good. What else? What are we going to look at in the food?
Mercury.
Mm-hmm. So know all of those. Healthy People 2020, environmental health. Benefit to reduce pesticide. Okay. And when we're looking at our environmental health, we want to keep in our mind pesticides. No, then when we're looking for physical hazards, we're going to be looking at all of that. TB, we're going to see in what kind of places? Where do you
Close
see TB?
quarters.
Yep, close quarters. Good. Good. And there's primary, secondary, and tertiary. The more I get into it, the more I like the explanation that you guys gave to me that your professor did, and I'm actually going to change mine for next quarter. So primary will be prevent, secondary will be screen, and tertiary will be treatment. I like that because it's pretty direct, and I can tell you why I don't like it, but that's not going to help you. So let's go with primary prevent, secondary screen, tertiary treatment. That's going to be good for that. Okay. Any questions on that?
No. Let's see.
All right. What's caffeine going to do to the body?
Respiratory. It's a
no
stimulant.
Caffeine.
Oh, sorry. It's a stimulant.
Palpitation.
Yeah, palpitation. It's going to mess with the heart.
Yeah.
Who are we looking at when we're looking at those migrant workers? What kind of assessments are we doing? What are we going to see with them?
Back pain.
Yep.
Pain.
Yep. Muscular
Neck pain.
stuff. Neck pain. Yep. Make sure with our Mexican culture, what are we looking to make sure?
That they're not just saying yes, that they really understand what's being explained.
Good. And they're going to want prefer non-confrontation. So they don't want arguments, you know, they want it to be nice and peaceful and nice and calm. They like some humor when they're looking at it. I think that's about it. I know it was a ton of information. It's a long study guide, but I tried to highlight for you guys. I think that's what's best. I'm going to.
Can we come up with a quality improvement question, please?
Yeah. This one we went over. This one?
Yeah, that one.
So I just want you to know when we're looking at quality improvement, what we're looking for.
Okay.
We're monitoring care. We're seeing how can we improve it. We're seeing what can we do to improve it, making recommendations, enhancing our quality, right?
Thanks.
Yeah. All right, so that about covers it, guys. I am going to ask that I'm going to call your name out. Just tell me who your professor is. If I say your name wrong, so sorry. Kashi, who's your professor?
Diana, Dr. Diana Surkowski.
Okay, thank you. Maddie, who's yours?
Dr. Lundy.
Okay. Dr. Lundy. Sharon, you're me. I know that. Thank you for joining. Mohammed, who are you?
Dr. Diane.
Okay, Diane. Okay. All right, Deshonda.
Professor Apple.
Does she teach it that way too?
Yeah, she did.
Yeah, she did.
She did. So see, I'm the only one who doesn't. I'm so glad we had this review session. Now I. All right, Mary Joy.
Dr. Rogers.
Okay, Dr. Rogers. And Nobleta.
Dr. Lundy.
Okay. Let's see. Adama.
Dr. Diane.
Mercy?
Professor Diane.
Okay. While I'm going over this, I want you guys to review the study guide and what we highlighted and things, and if you have any answers when I'm done, any questions, so sorry. Adiza?
Dr. Diane.
Pauline?
Professor Marvel.
Okay. Lisa?
Dr. Diane.
Oh, I got a lot of hers, huh?
Mm-hmm.
Salvini?
Dr. Lundy.
Dr. Lundy. Barbara?
Apple, Ellen Apple.
Okay. Anna?
Kathleen Marvel.
Okay. Jamie?
Dr. Lundy.
Lumetra? She may not be with us. Juanita?
Professor Apple.
Apple. Gina? No, you're not with us. Vishnu?
Dr. Diana.
Ika?
Professor Apple. Professor Apple.
Oh, thanks. You put it in there already. And Bella, you're Apple as well.
And Professor, I put my email just because I'm not sure how you're distributing the videos, just in case we don't get it somehow.
Yeah, so it should go through, it should be in announcements. I'll send a copy to Dr. Lundy and she should announce it out to your classes. I know last time I sent emails to everybody, but if you don't get it, I'll put my email in the chat and send me a note and I'll
Yeah, I have you.
Yeah, I remember you from last time. You have the cool name. All right, guys, what else can I do for you?
This was very helpful.
I hope so. It's a lot of content. I know that, guys. I know it is. So what I want you to do is I want you to focus on that study guide and what we talked about. I want you to use your common sense, use your nursing process, use your assessment skills when we're looking at these questions, okay?
So did you put your email in the chat?
No, I'm doing it. Yep, I'm doing it right now.
Okay, thanks.
Yep.
Thank you so much for the review session. I know you got emergency and then you still gave us your time, your attention.
Oh, no, thank you.
Thank you so much.
That's the life of a nurse. You know that. You guys all know that.
It was very helpful for the last test, so it really was for me.
But I hope this one is as well. I feel like this content is a little different presented. You know, the way it's presented is a little different than last time. So I'm hoping that this is helpful as well.
Professor, just want to ask, is page 136 or 9?
139.
Yeah, 139. Is that the only page you specifically referenced in your
in my lecture?
Your lecture, yeah. Or there are others? Because that might
There
be
was
helpful.
others. I do a lot of highlighting in the book for my students so that they can focus their reading.
Okay.
But that was a good one because it gives you examples.
Okay, thank you.
You know, sure.
Professor, would you be able to send a copy of your updated study guide that you just highlighted and made changes to?
Let me ask Dr. Lundy.
Okay.
Because that's how I do it. I know everyone doesn't do it. I have to be really careful because there was some lack of integrity with the study guides this time. So I laugh at it because I just feel so sad. Because the truth of the matter is, as nurses, we're gonna have to sit and take an NCLEX, and they will tell you if you are certified in anything.
We can't hear you, Professor.
And Professor, you are posting your study review for all the students.
I'm sorry, but we can't hear you.
Hear her anymore.
No, we still can't.
I wonder if she could hear us.
Can't hear you.
Not in yet.
We cannot hear you, Professor.
I'm so sorry, guys. I don't know why no one can hear me. Can anyone hear me? No? Bad about that. Oh, yikes. I don't know why. I'm so sorry. I'll wave bye and thank you.
Thank you.
Yeah, it's not working.